Three things that help me have a normal labor. Hi, this is Dr. Abinaya Vijayakumar. I'm a doctor and a post-pregnancy expert. For those of you watching me for the first time, I take post-pregnancy classes to pregnant women where I teach them how to stay happy, positive and confident throughout their pregnancy, because a happy mother gives rise to a happy baby. And I also help them to connect with the baby in the womb using simplified Garb Sanskar technique. To know more about the course, check the Tag Mango link provided in the description as well as in the pinned comment. You can also reach out to me on Instagram. My Instagram ID is Mommy with Bigger Dreams. With no further delay, let's jump into the video. In this video, I'm going to talk to you as a doctor, but more so as a mother, because doctor can say 1,000 things, but being a mother, when you go through the phase, things can be different. But as a mother, what I did, which helped me have a normal labor, this could help you also to have a normal labor. If you watch this video and follow these tips and had a normal labor, kindly do not forget to come back and comment below your labor experience. Number one, preparation. I prepared myself enough physically and mentally to anticipate what things will happen during my labor. For example, many of the mothers have this misconception that, you go into the labor room. Once the labor pain starts, you go into the labor room. Within, 5 minutes or 10 minutes, the baby cries and the mother has given birth. That's not the actual scenario. In reality, the first time mother can be in labor for even 24 to 36 hours, which is completely normal. If you are a second time mother, the labor could be faster and you could have a quicker labor. So first and foremost, you should prepare yourself for the reality and do not expect any fantasies. Next in preparation is I was aware about what exactly will happen in every stage of labor. For example, labor we divided into two stages. One is the latent phase and second is active phase. Latent phase is nothing but your cervical dilatation, that is opening of the mouth of the uterus, is going to be somewhere between 1 centimeter to 4 centimeter. This would take a lot of time because it will be very slow. Once the os is 4 centimeter dilated, the labor can be little more quicker, which we call it as active phase. So at every stage of labor, I was asking my doctor of how much centimeter I was dilated so that I can mentally prepare enough for how long will I be in labor. This preparation also includes cooperating with your doctor, because if you are not cooperating with your doctor for vaginal examination or for any other test or sample withdrawals, this process becomes complicated and little tiresome for your doctor. Remember, your doctor is there to help you and not against you. So you need to work as a team with your doctor, cooperate to the maximum so that your doctor can do the best for you and for your baby. Number two, breathing exercise. Many of the mothers does this mistake that shouting in pain, crying in pain, exhausting themselves at the very initial stage. This is not good for you because your active participation happens only in the last stage of labor where you need to push the baby out. So you need to save up your energy for the last phase. Instead, if you start wasting crying and shouting at the very beginning stage, when you're only like 0.5 centimeters, 1 centimeter or 2 centimeter dilated, you will become very much exhausted during the pushing phase. So instead of shouting, start focusing on your breathing. You can start your breathing exercise very well from your 20 weeks of pregnancy, such that you practice every single day of slow breathing, fast breathing or labored breathing. So when you take a slow breathing, it will be slow inhalation, hold for few seconds and then followed by slow exhalation. Fast breathing can be used when you are in intense pain or sometimes you need to divert yourself away from the pain. You could focus on fast breathing. Breathing techniques have two benefits for you. One is diverting your mind from the pain towards the breathing technique. Number two is bringing more oxygen into the body, thereby into the uterus and for the baby. A pro tip, you can hold a sturdy object like rim or rails of the bed very tightly and then start breathing. This would divert your mind away from the pain towards the sturdy holding as well as in the breathing. Number three, family support. Family support plays a very, very vital role during the labor. So choose your birthing partner wisely such that they would be bold enough as well as relaxed enough to handle you during the labor process. So what is all expected out of a birthing partner? A birthing partner can help you with hot water back massages in between the contractions, which can provide some amount of soothing. Number two, they will keep you informed about every stage of labor because you will be panicking. You will not know how to communicate with your doctor. Sometimes you will forget to ask your doctor, but your birthing partner will ask what stage of labor you are in, what is the plan, what are they up to, when is the delivery expected, everything from the doctor, and they will be communicating to you to keep you informed of every stage of your labor. Number 3, they can also assist you during the walking in between contractions and also remind you to do the breathing exercise as well as to keep you hydrated during the labor process. Number 4, in some unexpected scenarios where medical decisions has to be taken for the benefit of you and your baby, your birthing partner will act as a deciding person to choose what is best for you. So do remember these points and start preparing for your labor. I wish you all a relaxed, confident and an informed labor. If you like this video, do give me a thumbs up, and if you are new to my channel, kindly take 1 minute of your precious time and subscribe to my channel and press on that notification bell icon so that you receive regular updates on upcoming videos in my channel. Do share it with another pregnant women and also comment below your doubts about this topic. Until I meet you in the next video, stay happy, stay mommified.